Good afternoon. I'm Muriel Bowser. I'm the mayor of Washington, D.C. I'm joined by members of my cabinet, Chris Geldhart, LaQuandra Nesbitt, and Chris Rodriguez today, who are also part of my leadership team for the Emergency Operations Center for the district's response to COVID-19. Today, we are going to do a little bit longer presentation and a look back over the last 6 months to talk to you a little bit more about our experience over the last 6 months with COVID and talk a little bit more about what the next few months entail in terms of the district's planning. You will remember that we began planning back in January, more than 1 month before the district's first confirmed case. You will remember that we reached our peak in new daily cases on April the 30th. We entered phase 1, or what we're calling stay-at-home light, on May the 29th. And we entered phase 2, which we remain in on June the 22nd. Over that period of time, our government has done amazing things, and I'm so grateful to my team at the Emergency Operations Center, our executive team, communications team, who you have seen at some points daily and very regularly throughout this response for their hard work in communicating what can be tough information to share. So thanks to all of them. And this morning, we announced 47 new cases, sadly 2 additional lives lost. And you can see that over the course of our response to COVID that we've experienced more than 14,000 cases and the loss of 619 lives. We will have some time to talk today about how that compares to what it could have been and what we have in the future to make sure that we're building our city and our economy and our people back better. We spent a lot of the first few weeks, as you remember, we've shared this timeline before. In early January, we have processes in our HCMA for incident planning. We completed a tabletop exercise back in January with the district, regional, and federal leaders. I convened my cabinet at the end of February to talk about our preparations for COVID and released a mayor's order to direct our agencies to begin planning for a response. By March 3rd, we conducted our first briefing on the district's monitoring and preparation for COVID. And on March 7th, we had our first confirmed case. I declared a public health emergency, and we stood up our Emergency Operations Center at the Department of Health by March 13th. We also put the government into a modified operation and closed schools and issued a series of stay-at-home orders, gathering limitations, closing of non-essential businesses that culminated in a stay-at-home order on March 30th that combined all of the mayor's orders. We also convened a reopen advisory committee to help us think about how we would slowly reopen once we had the virus at a manageable level. So that is what we're going to spend a little bit of time talking about today, and the 6 pillars of the response that have managed our work, our communications with the public, and our planning. So I'm going to ask the district's Director of Homeland Security, Chris Rodriguez, to walk you through those pillars.
Thank you, Madam Mayor. And I just want to note, before we go into the 6 pillars, two of very important things that the Mayor talked about in the previous slides. The first was getting ourselves organized very early on before we had our first case. The Mayor convening her cabinet, implementing some of the changes to modified government operations, but also, just as importantly from a coordination and response standpoint, embedding the district's emergency operations center in the Department of Health. This is something unique that hasn't been done across the country, and I want to thank Dr. Nesbitt and the team at DC Health for welcoming the EOC into her building for the last 6 months. And that really has ensured, I think, our response was coordinated and resources got to where they needed to be. Next slide. So we knew that coming into COVID-19 and under the leadership of the Mayor and the direction from Dr. Nesbitt and her team at DC Health that we had to do 6 things, and we had to do them immediately. The first was that we knew that eventually, once the first non-travel related case showed up in the United States on January 21st in the state of Washington, we knew that eventually that would come here. And we knew that we would experience cases. And so we needed to flatten our curve very quickly. And we did that in a variety of ways. The first was through public health interventions. The Mayor mentioned some of the orders that she put in place in order to make sure that we had proper social distancing and community guidelines out there. Isolation and quarantine. So looking at some of our vulnerable populations and knowing that when we did identify positive cases, that we could put them somewhere in order to keep themselves and the rest of the population safe. Testing, under the operations section of the EOC, and Director Geldart is here, standing up our testing capacity and making sure we had wide availability of testing for our residents. Contact tracing, a lot of effort put into place for hiring contact tracers under the Department of Health, and you can see some of the numbers there in the success they've had in contacting new cases. Next slide. The second pillar of our strategy was to make sure that the public had accurate and timely information. You can see some of the statistics here of the number of times the Mayor has given public situational updates, all of the resources that were being brought to bear from across the district, all these agencies really making sure that we were pushing out accurate information. And in an emergency, from an emergency management standpoint, you need to be able to tell residents what they need to do and to communicate that clearly. Coronavirus.dc.gov, establishing a one-stop shop for all information and guidelines on our response. Next slide. We knew we needed to enhance our healthcare capacity. So with an increase in cases also comes a strain, a potential strain on the healthcare system. So again, making sure that we purchased and delivered personal protective equipment to our healthcare facilities, that we were bolstering up their capacity in the event that the system became overwhelmed. And that culminated really in the building of the alternate care site with help from the U.S. Army Corps of Engineers, from FEMA. That site, once we signed the contract with the U.S. Army Corps, took 22 days to build, and that is an amazing feat in terms of building up that mass surge site. Next slide. We also knew that in addition to the robust community support programs that are already in place in the district, even before COVID, we needed to expand that. Because with the virus and with the community transmission that we knew we were going to experience, there would be residents who would become unemployed because of the economic impacts. We had some of our vulnerable populations that also needed some of our support on food and commodities, and also needed assistance in the event that they lost a loved one. And through our virtual family assistance center, we've been able to contact 100% of families who have lost loved ones during this pandemic, and to offer some of the services that you see there. So emergency food and feeding programs, we needed to build up that capacity and have done that, and you see some of the statistics there. Also, the mayor mentioned early on modifying and ensuring continuity of government and continuity of government operations, transitioning to our remote work environment, making sure that the 60% of our workforce that's on telework had what they needed to continue their vital employment and work, meeting our staffing needs. We are looking at return to work guidance, leave policies, also making sure that some of our employees were detailed to very vital areas of our response. Disaster logistics. This is something that, working with the Office of Contract and Procurement and the Assistant City Administrator, new warehouses for streamlining how we got resources and personal protective equipment out to those who needed it. And you see some of those statistics there. And then making our DC facilities safe, knowing that we needed to do deep cleaning, and in some cases mapping out all of the buildings and their readiness for social distancing if and when employees came back. The last thing, in terms of our pillars of response, is managing the unexpected. And in any emergency, it's not going to be the only one that you deal with. We saw in the late spring and early summer mass protests and demonstrations here in the district after the murder of George Floyd, dealing with July 4th and the potential for large crowds on the Mall. We also had to plan to support a political party national convention on relatively short notice, and then the March on Washington. Those are some of the man-made threats. Now we're looking at severe weather. We are currently in the middle of the most active hurricane season since 2005. We had to prepare, and we have to prepare for severe weather. Just last week, we experienced the largest accumulation of rainfall in the district since 1950. The third hottest July on record. We had 44 days of heat emergencies here in the district this summer. And then, of course, as we are trying to respond and as we are responding to the pandemic, the CARES Act passes and doesn't treat D.C. as a state and essentially shorts us $750 million for our response. Where we are today. Okay, next slide. We're also looking at how, and you can see here on the slides, and the Reopen Advisory Committee that really looked across a broad spectrum of our economy, our culture, our COVID response, and looking at those recommendations for how we would do a phased reopening. And a lot of those recommendations have been implemented by the mayor. Next slide. This here lists all of our current guidance for phase 2, and it's a really good reference for where we are right now in this phase of the reopening amidst the global pandemic. I'm not going to read everything, but it's all there.
Let me just go back, Chris, before we move on, because one thing we wanted to highlight is not all of the activities that we envision could open in phase 2 have in fact reopened in phase 2. So we know that there will be additional phase 2 activities turned on. And we also haven't fully engaged with waiver requests that are permitted in phase 2. So we will spend some time looking at additional phase 2 activities and waivers that are allowed in phase 2 over the next weeks. I will move on to say that we are seeing more downtown activity as well. Effective September 20th, for example, the DC Circulator will resume its National Mall route. The Smithsonian Institution will, starting tomorrow, open an additional 4 of its offerings, and you can go to the Smithsonian's website to find out more, because I believe they all require you to reserve a free ticket. And these openings are in addition to the National Zoo, which has been open for several weeks, and I had the opportunity to visit and was very happy about that. And so just keep in mind what the restrictions are and the rules are and how you can get your free ticket. A full list of open attractions can also be found at Washington.org. We continue to monitor the economic activity that's happening in the district, what our experience has been over the last 6 months, and it is, to call it significant would be an understatement. Because of the shutdowns related to COVID, $1.5 billion in projected lost revenue we've experienced in the district over 2 fiscal years, the current one and the one that starts in October 1st. We have received over 140,000 unemployment claims and have paid out in unemployment payments $1.1 billion. We also know that our small businesses have been hit very hard. Over 53% of revenue has fallen over the last 6 months. We have responded locally. We have also called on all of our businesses to take advantage of every federal loan or grant available, and a lot of DC businesses have done that. We provided $33 million in micro-grant funding to support over 7,000 small businesses across the district. And we are currently, I think, designing or about to put out $5 million in child care grants. Our Great Street grants have been and will continue to be issued. And we have implemented recovery programs to support residents and workers. Our DMPED weekly convenes the town hall right from this room and is conducting targeted outreach and engaging businesses. The economic recovery team has been working for a couple of months on these specific issues, and we will talk about how members of the community can engage more in that process as well. Let me say a little bit more. We've had specific conversations about the cost of the COVID response and the buckets of money that we're tapping to deal with it. But I wanted to remind everybody that it is not insubstantial. Certainly to respond to this emergency, for our own personnel costs, business assistance grants, preparing and paying for medical surge, for universal testing, for making sure that our buildings are ready, to making sure that we are providing all of the housing and food support for people who are staying at home and experiencing hardship or need to isolate to keep our community safe. And we've also listed some of the funds that have already come in or will come in for the CARES Act, other federal grants that go directly to our agencies. And I'm also very proud of the work that HCMA and the entire team has done. I want to acknowledge and thank Chris Geltart for the operations section for supporting this work to actually submit our costs to FEMA for reimbursement. And I feel very good about where we are in that process. Because of the stewardship of district leaders, we've been able to tap our reserves and contingency cash to deal with some of these unforeseen costs. We have a plan to pay those reserves back. And we've asked our workers, our DC government employees, also to be a part of the solution. So I want to thank them for their sacrifices as well. We want to talk a little bit about where we stand with the virus, and I'm going to ask Dr. Nesbitt to say a little bit more about this. You are familiar with this statistic that shows what's the daily average of cases per 100,000. This is a figure that we use when looking at hot spots around the nation, and we wanted to show you how the district stacks up with other major cities so that you can see that we're doing a lot better than some, and some are doing better than us. So we want to stay focused on that. Also, we have over the last several months been following our progress and reporting it to you. We talk about community spread, our health system capacity, our public health system, and also the level of engagement with the community. So I wanted Dr. Nesbitt to talk a little bit more about the community spread, capacity, and level of engagement.
Sure. Thank you, Madam Mayor. Today, we want to renew our focus on how we are monitoring our progress in responding to the pandemic in the District of Columbia. As we have discussed and shared with you all, we use a number of metrics at DC Health for surveillance purposes, which is to help us be able to understand how the pandemic is moving from a data perspective in terms of the number of people who are impacted, who is impacted from an age group perspective, racial and ethnic demographics, where geographically people are impacted in the district. And we also use metrics to help us understand how to manage. So where we need to shift or allocate more resources, how we need to make policy decisions in terms of understanding who is impacted, what types of public health interventions would have the most impact, or if we've had interventions in place that are no longer effective. So we should shift or alter our strategy. As we have learned more about the pandemic, the nature of the pandemic, as we learn more about the virus, as we understand from a surveillance perspective what the picture of the pandemic looks like, we better understand the utility of specific metrics. With that in mind, and we furthermore, given the types of questions or the inquiries we get for data, we recognize the need to make data available on a more consistent basis. With that, we are renewing our strategy for public data to be shared on our dashboard and in this forum, and categorizing the data so people understand what metrics are used to measure which things relative to the pandemic. So you will see here on this chart that we have categories related to the level of community spread. So this will help us be able to determine when we have substantial community spread versus moderate community spread versus minimal community spread. And those 4 indicators there that we will be publishing publicly are all indicators that help us to give a good picture of what community spread looks like in the district. In terms of capacity, there's capacity that exists in our health system to be able to respond to the pandemic, and capacity in our public health system. So these are a few of the indicators that are best to help people understand what the capacity looks like in that system. So we'll be able to articulate if we have insufficient capacity, moderately sufficient capacity, or sufficient capacity in our health system and public health system. And you heard me talk about the need to have the community engaged in the process in order for us to have a great response to the pandemic. And there are a number of ways that the community can be engaged in the response. Initially, we will be reporting on the way that the community engages with the contact tracing process. And I'll talk a little bit more about that with the review of the metrics. So for community spread, we will be retiring the previous metric that we used to determine if we had sustained decreases in the number of reported cases. And we will be replacing it with the metric that the mayor referred to in the previous slide of daily reported cases per 100,000. We already use that metric to help us look at how we compare to other major cities, how we compare to other states, and we use that metric for, as the mayor mentioned, our travel advisory. We believe that this metric is far easier and useful for the public to be able to follow along with. We still have to have this metric show declines over a sustained period of time. But when you see this metric on a trend graph, it'll be a lot easier for people to be able to see if there is a sustained decrease over a 2-week period in daily reported cases than people being able to follow along with the statistical methodology of the that we were using in our previous method. So for quick reference, under the previous methodology, where there was, then we were reporting on symptom onset date and community spread. When we had day 0, when we entered into phase 2, we have over 55 days where the number of people who reported symptoms on a given day was higher than day 0. So that makes it very difficult for the general public to follow along with the statistical methodology that's needed to see if we have sustained decrease. It will be visually a lot easier for people to see if a line is decreasing for 14 days based on the daily reported case rate, and to be able to hover over that line as opposed to being able to comprehend those statistical computations. So you see where we stand as of today with our daily reported case rate of 7.24. The other metrics there you're all familiar with. But we've shifted the percent of positive cases from quarantine contacts. It doesn't appear down with the other contact tracing metrics because it is more of a picture of what community spread is as it is a feature of community engagement. We're giving you some other metrics that we report out on. We share the information all the time. Test turnaround time. Is a metric of the health system capacity, our laboratory capacity. Labs are part of the health system. You'll also see the number of tests that are being done routinely as a function of tests per million. Many other states report that. And the public health system capacity, those are where some of the contact tracing metrics that are already routinely reported will exist. The newer metrics, the level of engagement or community engagement, are additional metrics that are a function of contact tracing. We know that we are better able to get to people who need to be quarantined if we can complete interviews for new positive cases within 3 days. So while we have provided information about whether or not we can make a contact attempt to a positive case routinely, we will continue to do that, but whether or not we're able to complete an interview, meaning fully understand all of the context of a new positive case within 3 days, and then get to the people that they were around, understand the environment that they were in and all of their patterns and behavior within 3 days, is extremely important to whether or not we are able to do what we call box it in related to controlling the pandemic. And so that metric will be reported. We also, as part of completing the interview, what's critically essential is whether or not people are providing us a list of their contacts. And so we're going to publicly report that metric. And we really do need the public and positive cases to give us a list of their contacts. And as you can see, those two metrics are lower than the metric that we report out on with our ability to reach people or to contact people, rather. So those are new metrics that you'll see. We'll start reporting them on the dashboard early next week, and they'll be available on the dashboard daily moving forward. Thank you, Madam Mayor.
Thank you, Dr. Nesbitt. So let me just say a little bit about the coming days. And you've heard me talk a lot about a focus of all of our efforts is getting our kids back to school. We've gotten a lot of questions about devices. I think everyone knows we started our new school year on August 31st, and the first grading period or the first term runs through November the 6th, and DCPS is 100% virtual. We have distributed more than 26,000 devices. And let me just also say that we are very carefully tracking enrollment and attendance, that virtual equals also, just like any regular school, virtual is mandatory school. So we need our children to be registered, and we need them to be attending, logging in and attending. So our in-seat attendance on September 14th was 85%, and that is compared to 92% the same time last year. We also have enrolled, so this is for all of our schools, and including the public charter schools, 87,609 students enrolled at a public school as of September the 15th, and that is compared to 92,162 students enrolled last year. So we continue to focus on how we can offer in-person learning opportunities in addition to virtual learning opportunities beginning on November the 9th. Director Geldhart is going to be our point of contact from the Emergency Operations Center, working with DCPS on all it needs to get ready for that opportunity. Let me also say that we continue, and sometimes this can sound like a broken record, but we have to play the broken record because how we get back is really dependent on all of us, and we have a shared responsibility to each other and to our community about how we are able to combat this virus. So if you have symptoms, get tested and stay home. Isolate and quarantine immediately. And as Dr. Nesbitt has mentioned, cooperate with case investigators and contract tracers because our ability to get back means stopping the virus if somebody gets it. So we can set up the wonderful contact tracing program, which we have done. We can do our best to streamline the process, which we have done, but you have to do your part too, and that is to cooperate, to be honest. Our investigators are highly professional and confidential, and they know how to work with public health data to keep us safe and to protect your privacy. So please cooperate with them. We also remind everybody to limit your travel in general and quarantine after visiting hot spots. We update that information regularly, so please pay attention to that. My big concern throughout this pandemic has been small gatherings. We know public gatherings, large gatherings in our venues and in our other commercial facilities, but we also know that people in their daily lives have small parties, they have friends over, they go to cookouts, they celebrate different events. And unfortunately, I think that's when a lot of us let our guards down. So please be mindful of, if you're going to a gathering, be mindful of all the social distancing requirements, including wearing a mask inside and out when you are around people who are not in your household. Also, choose your activities wisely, and just because I like to say you're invited to something doesn't mean you have to go, and you know what your level of activity and exposure has been, so think about that when accepting an invitation, and practice how you can politely decline based on your situation. We also just kind of wanted to lay out some of the other big items on our list. Our DC Health and HCMA are planning for the second wave of vaccination, for a possible second wave and vaccination planning. We're planning for the hybrid return to school, the hurricane season that has already been discussed, and election week, which is fast approaching. November, of course, we continue election day and the pre-inauguration planning and preparation for heightened demonstration activity in Washington, D.C., in addition to our winter weather. And those activities will occupy our attention for the remainder of the winter. I'm going to ask Dr. Nesbitt to talk about COVID-19 vaccine planning and the flu vaccine.
Sure. Thank you, Madam Mayor. Yesterday, we received a template from the federal government that will assist states in developing our SARS-CoV-2 vaccine plan. that is due in the middle of October. However, we have been meeting routinely with federal agencies and our regional and national partners and stakeholders to develop our plan, drawing on our learnings from the H1N1 planning process. We will be working a lot to update the technology that we have in place with our immunization information system, working with our existing partners and developing some new public-private partnerships as well. We've had conversations internally around prioritization for the vaccine. I'm sure many of you now have been socialized to the concept that when vaccines are approved because they are safe and effective, initially there will be minimal amount of doses available nationally and distributed to the states for allocation to higher priority groups. And then as production increases, more vaccine will be available to the general public. ACIP and the national academies are meeting to talk about how those priority groups will be established. Their next meeting, I believe, is September 22nd, and we expect to have some guidance at the national level around priority groups that will inform what planning looks like on the state level. To that end, we will be working very aggressively with our seasonal influenza approach and engaging more public-private partnerships that we'll talk to you about next week, early next week, to have more people vaccinated in the district for seasonal influenza. We want to make sure that we keep our risk for seasonal influenza very low at the community and individual level. We know that some of the same individuals who are at increased risk for severe illness, hospitalization, and death for influenza are the same groups and populations that will be at severe risk for severe illness, hospitalization, and death from COVID-19. So we want them to be sure to protect themselves from seasonal influenza this year and to get vaccinated. And we're going to be doing a lot in the district to create opportunities for them to have vaccines. How we do that will definitely inform how we can vaccinate large groups of our population for SARS-CoV-2 when that vaccine becomes available. Thank you.
Thank you. So with that, that concludes our part of the presentation, and we're happy to take a few questions. Yes, Mark?
Dr. Nesbitt, if we could pick up right where you left off there with the vaccines. You had mentioned that CDC had given you some indication of mid-October as a date for something. Can you tell us about that? And when could first these high priority groups and then second the general public in the district expect to actually receive a vaccine?
So you'll recall that when I spoke before, it was around the plan, the submission of the plan. So we've received the template yesterday and the plan and the due date for the state plans for SARS-CoV-2 distribution and allocation and distribution. And that due date is October 16th.
That would be when you would submit your plan?
That is correct.
Okay. So do you have any indication? I mean, I'm sure you heard what the president said and then what the head of the CDC said. They're kind of at odds. What say you as far as any kind of general timeline people could expect, at least the first round of high priority people to see a vaccine in D.C.?
In the meetings and vaccine summits and planning summits that I've attended and heard from researchers, scientists, medical physician scientists who are leading trials, they estimate that vaccine could be available for priority populations the end of 2020, beginning of 2021 at the earliest. And who those priority groups are still being determined.
Yes, sir.
Mayor Bowser, real quick, I know you mentioned the grants that are being given to businesses. Realistically, how sustainable is this form of relief for the district as far as how long we can be giving these grants? And just another question about that, the businesses, they're wondering when they can all open and resume things. Any kind of timeline or anything as far as to when we can start thinking about phase 3?
So your question was how sustainable is what?
Just the small business grants that you've been offering.
So, yes, so your question, let me just start with that, is how sustainable are the small business grants? As you recall, very early on in our pandemic response, we identified $25 million, which grew to $33 million, where we could offer some immediate but small relief to our businesses. More than that, our businesses have also taken advantage of the Paycheck Protection Program. And even with all of that, it's not enough to fill the needs that they have. Some businesses have been completely shut down. Others have seen their customers fall and their revenues fall. So there are still going to be gaps. We know that we won't be able to locally fill all of those gaps, and that's why having real federal stimulus and sustained federal stimulus is what our businesses are going to need to hold on and to keep their employees employed, but also to come back. And that's why we've been very focused on the federal government coming through with another CARES package that would provide that type of economic stimulus. And the second part of your question was?
Just any indication as to when the district can start thinking about moving into phase 3?
Well, as we have said, the big thing that we're focused on getting open that's going to make every activity continue more, we think, is getting people back to work and kids back to school. So just saying something is open doesn't mean that you have more customers. And we also know just opening doesn't mean that people will come back if they don't feel safe in doing so. So there's a lot that we're focused on making sure that our health numbers are in a good place, but also that workers are confident in coming back and consumers are confident in coming back. Yes, sir.
On contact tracing, what reason, does district have any idea why you're not getting more responses from new cases or their close contacts?
Dr. Nesbitt?
So there's a couple of theories that, first I want to say this is not a phenomenon that is unique to the District of Columbia. So let's just make sure we introduce that very clearly and concisely. And in that same vein, we are a gold star in terms of contact tracing. So that those two things kind of going hand in hand makes it very disconcerting in terms of where we are in terms of completing interviews. Now, our overall interview completion rate is around 75%. So we do have a higher proportion of people completing interviews. The issue is the critical need to have interviews completed in a shorter period of time or within that 3-day time frame. Because what we don't want is people who are close contacts of a positive case who don't know that they are a close contact, still out in community, not quarantining because they don't know that they need to be quarantining, who could be asymptomatic, potentially exposing other people, and those could be reasons why we aren't stopping the spread, disrupting chains of infection, et cetera. So it's critically important that we have completed interviews within 3 days period of time. The issue as to why people are not disclosing a list of contacts, again, is not a district phenomenon only. What most well-cited one is people suggest that there's concerns around immigration, law enforcement, et cetera. We believe that that is an issue or concern, but it is overly stated, right? So people mention that one and then they walk away from the conversation. What is understated is the issue that people have with stigma. They don't trust the conversation, the part of the conversation when we say your information is going to be kept private. So they're worried that they've been out socializing with friends, they've been to happy hour, they went to a restaurant with the people outside of their household, they showed up at the fundraiser that was less than 50 people, and they don't want people to know that they're the potential reason why there could be an outbreak in their small social circle. Right? So they are afraid to disclose to us the list of contacts because they don't have confidence that their name isn't going to be mentioned. We don't have to name you. We don't have to necessarily disclose a very detailed amount of information that makes it clear who the person is. What is important is that we can notify people that they have been exposed, that they need to quarantine, so that we can reduce the risk of transmission even further in the community. We can't say it too many times, that because of the ability for people to be asymptomatic spreaders, we really have to have that contact information to put people on notice so they can quarantine as a critical part of our strategy.
So what do the contact tracers do to assuage those concerns that people are going to be outed as having coronavirus?
Sure. So we've been deploying some new strategies, and we're working on a communication strategy where we can potentially get some folks to provide testimonials where they can talk about what the process was like and how we've built trust and we've built confidence. So we make sure that they understand the disclosure process. We've had some people who work for us who have worked in sexually transmitted infections and tuberculosis, where these same privacy, health regulations and privacy laws are in place to help people build confidence and understand that their information won't be disclosed. We've also begun to do some home visits to help people understand more about what the process is like, as well, to help build trust and to get them to understand the privacy laws as well. So those things have been helpful and have been helpful in getting people to be able to understand the confidentiality around the process and how participating in the interview itself is a social good. And we do know that people in DC like to generate social good. So we've been able to get people to comply or adhere from that perspective as well.
And so there's metrics for the percent of positive cases interviewed and the amount of close contact information provided. What about close contacts interviewed?
So we're focusing more on the positive cases because that disrupts the chain of infection. The close contacts being interviewed is not as critically important for us right now unless they become a case. So we provide the information about contact attempts with close cases and with close contacts, and then we monitor internally the contacts that we reach, et cetera, to be able to give them the information about being able to quarantine. But we're focused more on these metrics because of the critical need to have people understand we can't move in terms of being able to control this or turning on more activity if our positive cases are not engaged.
Dr. Nesbitt, with the new metrics, it will come to no surprise to you that I'm a little confused. So if you could help me understand with these, and if we could first stay with the contact tracing, are you learning anything more now about clusters from contact tracing? Can you identify clusters?
Right. So, okay, great. So, Mark, you're not confused. You're getting clarity.
Well, I will.
So to make sure I'm putting this in context, these are metrics that we look at, and that helps us paint a broader picture that we're making public, so the public has clarity around the broader picture that we're painting. In terms of whether or not we are understanding more about clusters, they don't tell us that we have clusters. So we don't have clusters that are emerging. The best way to be able to say that we would be having clusters would be to see that percent of positive cases from quarantine contacts begin to increase.
Okay, so now can I ask about the community spread metrics?
Yes.
So can you tell us, because you said, because in the past you've told us what your goals are, what, like for 7.24, is that good or is that bad? And sometimes you highlight them in red when you're not achieving your metrics. I'm wondering if you're going to do that. But you had said that this metric will help you determine whether we're at substantial, moderate, or minimal community spread. So which of those three are we at right now? Can you tell us that?
Sure. So when they appear on the dashboard next week, you'll see a framing that'll help you also be able to put them in those categories. Right now, we're still in moderate. Nothing's changed from yesterday. I'm just introducing the new categories for you.
And so, does that mean that, because it sounded like you said before, if we were looking at the old metric, that since day 0 of phase 2, we've experienced 55 days of where there had been days of increased community spread.
Right.
So is the trend that community spread is still increasing?
No. So think of it this way. Community spread is not a single metric. That's why I wanted to categorize it this way for you. And even in the previous presentations, I don't know if you shred those decks when you leave, but if you go back and you look at an old deck, there was community spread and there were 2 things. There was like rate of transmission and then the days of decline. But most people would just look at the days of decline and say that's community spread if it's up or down, and then you'd say we still have community spread, we don't. But there's a host of metrics that in combination help me to think about where we are with community spread. So I'm showing you here in this bucket, now there's a bucket for community spread, and showing you even more metrics that I look at in combination that help me to think about it. And I would even explain to you all that quarantine contacts helped me to think about whether our cases were connected or not, if we had clusters, et cetera. So now I've officially grouped them in a bucket that helps you to think about community spread, or see very clearly community spread is not one single metric. It's not even 2 single metrics, it's a combination of metrics, okay? So it's not just that one if cases are declining. Now, because I have this kind of locked in my memory, on the day we entered phase 2, there were 44 cases that are positive cases who said their symptoms started that day. When we look at the number, when we look at the cases, when I look at it on that chart, there's 55 days of days where people reported their symptoms, where it's higher than that number 44. And why it was so difficult for folks to track along with it is because it requires a statistical computation that's just not easy for non-statisticians or people who do public health every day to follow along with that. Looking at the daily reported cases per 100,000, and being able to see that on a graph, and to see if it's going up, if it's going down, if it looks like it's going down consistently for 2 weeks, it's a lot more intuitive. Whether you're a math person, not a math person, you just have to be able to follow visual cues. So knowing that's one of the community spread metrics, if it's moving in the right direction for 2 weeks, can help you understand if we're moving in the right direction on one of the community spread metrics. And I think that's going to be a lot easier for people than the previous one that we've decided to retire.
And that would follow with the other 3 metrics?
Yes.
As well?
Yes.
Just following that downward trend?
Exactly, exactly. And we're going to color code things for you, show you where we want to be, and all of that will be on the dashboard.
Yes, Perry?
Yeah, a few weeks ago you had said you wanted to bring back some kids for some small in-person learning in DCPS. The city administrator said something similar on his phone call on the town hall yesterday. Where do we stand with those plans, and what would that look like? What would that program to bring back some kids look like?
Well, Perry, I don't have a specific answer for you. I understand that DCPS has in hand and is reviewing more than several, I think at least a dozen proposals from principals and schools about what that would look like. And I think they're spending some time kind of kicking the tires on them, and then they will have something to announce.
And when you say at least a dozen proposals for principals, I know does that mean that most principals did not submit a plan for reopening for their schools?
I would like the chancellor to answer that. I don't want to misspeak on that.
And do you know yet which kids the city would want to prioritize to have returned back before that hybrid model?
Not having seen the proposals, I don't want to comment on that.
And you do think still this month we can bring back some kids? The city still wants to bring back some?
I wanted them to, yes, If you're asking me, is yes, but logistically and operationally, that's gonna be up to DCPS to figure out with what they have proposed and if it works and how soon they can bring it back. As I mentioned earlier, I've asked Director Geldhart to work with the Chancellor so that they're tapping into our emergency operations support to get DCPS what they need. And I don't say get it, I mean bring it to bear. Yes.
So this presentation is a retrospective about the last 6 months. What mistakes has your administration made, and what have you learned from them?
Say again?
What mistakes has your administration made in the last 6 months, and what have you learned from them?
I don't know that we are really ready to say this was a mistake, or this could have been done better, or this was fantastic. I don't know that we're in a place to talk about that yet.
Well, we see other cities that are doing better, like New York City and Seattle. Have you been in touch with officials there, and have you identified strategies that have worked there that could be applied in DC?
Well, New York City is doing better now. And so I think we should be careful not to compare apples and oranges, so to speak.
But are there any other jurisdictions that you've looked to for lessons as we're trying to reach that point of going from moderate to low?
We are in touch with jurisdictions all the time. Dr. Nesbitt participates in a discussion with health directors. I think that where we are really focused as well is learning from other cities. We're all kind of picking each other's ideas about bringing the economy back and slowly reopening and the things that are working and not working, so that we will continue to do those things.
Do you support extending the eviction moratorium through 2021?
Do I do what?
Do you support extending the eviction moratorium through next year?
We have that tied to the public health emergency, so I would look at where we stand with the public health emergency. Yes.
So keeping in this theme of 6 months, look back, in April, you projected or were preparing for the possibility that the peak might be as many as 13% of DC residents, more than 93,000 testing positive, having been infected, and deaths between 220 to a max of 1,000, with the hospital surge coming in late July. So we know where our numbers are relative to those, and I'm just wondering if, we know flu season is yet to come, but did we hit our surge, and have we are you preparing for a second surge? You think, what is the next 6 months should we brace for as far as that? And with the fatalities, you were pretty much spot on is where we were. With the infection rate, it was a much higher projection than what we were actually seeing. So I'm just wondering what you make of that. And why
Well,
you
this
think-
is the first thing I make of it is that residents flattened the curve and did exactly what we asked of them. And I think part of you will remember we were at the Armory and talking about a model. In fact, I think we presented 3 models at the time, and there were ranges of expectation. And I think that the virus has underperformed in this city because of the willingness of people to adhere to the public health guidance. So we're grateful for that. We have been able to moderately contain the spread of the virus, but it's still circulating and it's still out there. People are still getting the virus and people are still dying. So it's still here. So I think that when we look at the ability to flatten the curve so our public health system would be able to accommodate new cases, I think that's what the public health system would ask of us as citizens, to give it the time to be ready for sick people coming to the hospital. And we have done that in this city. We're below where we are for our normal capacity, and we have surge capacity available so that we can deal with people coming into our hospitals who are sick. Certainly, I think it's tragic, the number of people who have died from this virus. We've seen how it attacks existing conditions that are prevalent in Washington, D.C., and so it has shown a real spotlight on the things that we need to do in our regular health system and in our city to make sure that people have healthier outcomes, period, that they have the ability to live healthier lives. So we have really seen a spotlight on that. Yes.
Hi, I just wanted to go back to contact tracing for a moment. Dr. Nesbitt, you mentioned earlier that one way the administration has tried to assuage fears people have around contact tracing is through home visits. Could you talk more about the home visits and how many have been completed so far?
Yeah, sure. I don't have that data with me today, but we'll talk more and go more in depth and talk about that early next week. We're still conducting some analysis on the initial findings, and the program will continue as we have found it to be a useful tool.
Yes.
Yeah, so a two-part question. Based on the current scientific metrics, do you feel like schools, scientifically speaking, are ready to reopen? Are we ready to send back kids to school? And if so, are we logistically ready? Meaning, have all the ventilation systems been checked? Is there enough PPE? Do you have the agreements or the discussions that you need to have with the teachers union, the principals union, and all the other unions to make sure that they're ready when science allows it?
Well, what we established a couple of months ago, Perry, that hybrid learning can happen in phase 2. And we're in phase 2. So to answer that question, yes, hybrid learning can happen in phase 2. In terms of kind of our workforce readiness, we continue to work on our workforce readiness, and part of Director Geldart's charge is to work with DCPS to make sure that we have the workforce readiness that we need for in-person learning at the start of term 2. And finally, what I call the environment or sanitation conditions, PPE, all of that. We have done, I think, a fantastic job in acquiring the PPE that we need. And we have that in stock and ready to go right now. And we have a plan to make sure our ventilation systems are updated for November the 9th.
So metric-wise, you feel confident we are ready to do, based on the metrics, hybrid learning, and we have been since we've been in phase 2, metric-wise?
I mean, I did answer that.
You did?
Yeah.
You did? Okay, thank you.
Thanks. Thank you.
One last question on schools and then another COVID question. Are charter schools, are you tracking testing, if at all, at charter schools amongst students and teachers? And is there any data that show whether or not there have been charter school students or staff who are doing in-person learning already, having any test positive cases?
We have, we've asked the DME to kind of do an informal survey of any schools that are doing any part of their day in person. And so they're doing that now, and that would include any charter schools or independent schools. And we're basically doing that to see what's working, what best practices, anything that they can share with us. And any reports of cases would go directly to DC Health.
And then can I ask about Halloween? What are your
It's October 31st.
What are your recommendations for the ghosts and goblins who, I mean, you go to the store and the candy's out, will you be allowing door-to-door trick-or-treating come Halloween?
I expect that DC Health will spend some time providing guidance, some guidance documentation, and actually they'll be doing that pretty soon.
What does that mean? That it'll be allowed, but with some, are you going to cancel Halloween?
I can't imagine those words coming from my mouth, Mark, but we need it to be safe. right? So in all seriousness, we know that that's a lot of passing of things, and so we want families, and we as the government are going to work on some guidance around Halloween. Okay, is that it? Thank you,
Can we ask-
everybody.
I'm sorry, can I ask an off-topic question?
Okay.
The revelations that the DC National Guard was asked prior to the White House event at Lafayette Square in front of St. John's Church about the type of munitions and the heat ray that they might possibly have to deploy against protesters. Have you talked to the National Guard or anybody there about that? And just what is your reaction that the DC National Guard was even asked that?
Well, I think you know how I feel. I've made it very plain how I feel about the operations in front of the White House on that day, and in making sure that protest and local police activity are handled by the Metropolitan Police Department. We, of course, have the ability to ask for mutual assistance, be it from other law enforcement agencies or from the DC National Guard. But local policing needs to be handled by MPD.
But the idea that they were asked about the heat ray and other munitions that would be used, that could possibly be used on DC streets?
Well, it highlights the problem, Mark, of having local policing done by unaccountable federal chain of command. And that's why I've been very consistent about local policing matters being handled by the Metropolitan Police Department. Thank you, everybody.